we're looking at depression and anxiety in the wrong light. Those are symptoms. It's not a disease state. An SSRI, selective serotonin reuptake inhibitor. Does it actually help? Does it heal? Is a better question. Does it heal the person? I don't think so. What if I check their testosterone? What about their progesterone, their estradiol? Your health actually gets better over time with HRT. I think largely most patients being given things like SSRIs, for example. I think that's inappropriate. I think of that as an alternative. Actually, this is probably even better example of an alternative therapy, because what the literature has shown, and I talked about this at my conference, that the literature has shown, Dr. Joanna Moncrief, one of the leading research psychiatrists in the world out of Oxford, proved this in 2023, I think it was, in the summer of 23 in June. I think I read this study and was just floored by it. Meta-analysis of all the different randomized control trials out there in observational studies looking at SSRIs. Do they help? Is that the actual root cause? Is serotonin, more specifically, what is causing low serotonin depression? What if the randomized control trials say in observational studies? No. It is not clear at all that it has anything to do with serotonin whatsoever. In fact, it appears that elevated levels of serotonin can cause depression, which makes sense. If you've taken my HRT University course, you would know why that is, because serotonin is not a happy hormone. It's a stress hormone, stress neurotransmitter. But more importantly, we're looking at depression and anxiety in the wrong light. Those are symptoms. It's not a disease state. It's not like type 1 diabetes where your pancreas is broken, your beta cells don't work. We got to give you insulin. It's pretty obvious. We can cut you open and look at that. We could check your blood sugars. We could do all these different things to determine that. We can't do that with depression or anxiety. I can't cut your brain open and figure that out. It's multifactorial. There's a lot of different things. And I think actually hormones are probably one of the more foundational pieces of that puzzle. I mean, if you go into a doctor's office and you say, I don't know, doc, I'm tired. I feel kind of sad and lethargic and, I'm gaining all this weight and I'm not sleeping that well, blah, 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 blah. Well, they're going to have you fill out a PHQ-9, this little survey, 9 questions, and it's going to basically help them determine whether or not you're depressed, which probably you're going to score high because you said all the things that you're feeling, and that all equals major depressive disorder. And what do? They give you an SSRI, selective serotonin reuptake inhibitor, and it's going to whisk away all your problems. And it doesn't. It really doesn't. Can it help? Yes. Just like oral birth control can really get rid of migraines really well. Absolutely. Does it actually help? Does it heal? Is a better question. Does it heal the person? I don't think so. I think in the long term, again, short term, potentially in the long term, which by the way, those medications were never meant to be taken for longer than 3 months at best. In the long term, what we see is that these medications destroy your ability to produce sex hormones, something called steroidogenesis, right? It destroys your metabolism. It slows it down. It can destroy your libido and sexual function. It can cause you to gain weight. It increases your likelihood of metabolic disorder at large, disease. That is not a medication that makes any sense if we're saying that the literature shows that low serotonin has nothing to do with it. I'm giving you a medication that we don't even know really. I mean, in theory, we're just assuming this is how it works, really. It's theoretical. It's called the monoamine hypothesis, really. It's hypothetical, really. Like it's all based on these ideas that we had and which has been disproven. That's been almost disproven, relatively speaking, since like the early to mid 90s. And yet we continue to use an inappropriate and what I would consider alternative therapy that has very weak evidence around it and frankly, very little health benefits over time. Now, if that same patient comes into the primary care office and says, I'm feeling kind of low mood and maybe depressed and, I'm gaining weight, blah, blah, blah. What if I check a thyroid panel? What if I check their testosterone? I don't care if they're male or female. What if I check either one of those two things? What about their progesterone, their estradiol? What about their things like vitamin D even, right? There's so many things we could be checking. Zinc, magnesium, there's 1,000 things we could be checking, but let me just speak from an HRT perspective as one of the most foundational things and beneficial and wonderful and safe things we could do for a human being. Why wouldn't I look at hormones? Which, by the way, if you look at If you just type into Google, thyroid and depression, testosterone and depression, estradiol and depression, you'll find hundreds, thousands of articles showing there is quite strong association. In fact, with thyroid, there's not even, I mean, it's practically a causative agent of depression, which is a symptom. Again, it's not a disease state. It's a culmination of things, right? Oxidative stress, environmental factors, hormone dysregulation, right? All of those things compile and lead to a state of depression, right? Which is just a series of symptoms. It's a syndrome, right? It's more like PCOS. It's a culmination of things that lead to this problem. So is depression real? It's super real, guys. It's the most real thing ever. I mean, if you've ever suffered from depression personally or known someone who experiences that, it's really miserable. It's not pleasant. It's awful. And so I think what that person deserves is a not an alternative therapy, which would be like an SSRI, which doesn't really hold much water at this point. What they really deserve is a foundational therapy, a therapy that's evidence-based and not only can provide amazing benefits in the short term, but also extraordinary health benefits in the long term. Right? Your health actually gets better over time with HRT. We don't see that with a lot of medications, right? Most medications, it's a huge give and take. I give you this medicine, the likelihood of you developing X, Y, or Z, side effect or adverse event or long-term poor health outcomes is high, right? I mean, we see that really clearly with like immunosuppressants, for example. They're terrible for human beings. Will they get rid of some of the symptoms that they're experiencing? Yeah. Over time, is it great? No, it sucks. It's awful for those people, right? Pardon, my phone's buzzing. I mean, it's no good at all. So I think that when it comes to hormone replacement therapy, I think it's very, very clear that hormone replacement therapy is vital for every single specialty of medical providers to understand and hopefully utilize. And if they can't do it themselves, which is fair, again, if you're a surgeon or if you're, just in a very, that super, super subspecialty of medicine where you really don't have time to do it, someone in your universe should be doing it. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.